Hello. Welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, owner of Wells Legacy Health and Wellness. I am a family nurse practitioner and I hold a doctorate degree in nursing practice. So that's where the doctor comes from. If you are the first time viewer, first time here with us, welcome to Wellness Wednesday. If you are a regular, thank you so much for your consistency and for your dedication for keeping up with us here on Wells Legacy Health and Wellness. This month is the month of May, as you already know. In the month of May, there are several different health topics that are highlighted. And last week, and in the previous week, we talked about mental health awareness. Tonight, I want to highlight stroke awareness because stroke awareness is also something that we focus on in the month of May. So I'm not sure how many of you have a family member, a friend, or colleague, or a loved one, or someone that their life has been impacted by a stroke. And if you know someone, you know that the individual that's affected by the stroke is not the only one who's impacted. Their family's impacted, their community's impacted, and lives are changed overall. And witnessing a stroke can be scary, but being able to identify the warning signs that our bodies give us is so important and can save a life. So we're going to talk about strokes tonight. Did you know that strokes are the second leading cause of death globally? And that it's the leading cause of long-term disability globally. Every year, around 15 million people worldwide suffer from a stroke. In the United States, every 40 seconds, someone has a stroke. That results in just a little over 795,000 strokes each year. Those numbers are very impactful. Just one is too many. Just one is too many. And so there's some signs and symptoms that we need to be aware of when we're talking about strokes. We have to be able to, one, recognize and react to a stroke. As I mentioned previously, a stroke can change someone's life in a matter of a minute or moment. A few seconds and someone's life has been changed. So some of the symptoms that we want to take a look at when we're looking for a stroke, there's an acronym for it, and it's called B FAST. So one is B, balance. Individual may experience dizziness or loss of balance. E, eyes. They may notice some changes in their vision, double vision, blurred vision. They may lose partial vision. We need to be aware of that. F stands for face, facial drooping or severe headache. You might see that one side of the mouth is lower than the other. When we ask them to smile, we may notice that their smile is uneven. Arms, A stands for arms, and there may be some weakness or numbness in the arms of that individual, one-sided usually. S stands for speech, and that's trouble speaking, or there may be some confusion. You may have an individual who's talking fairly normal, and then all of a sudden their speech begins to slur, or they're stuttering, or there's repetitive speech, or they're searching for words. They can't find the words to say or how to react, or they're not able to speak at all. And then time. Time is of the essence. We have to be able to notice these signs and react quickly. So when we have somebody who is experiencing a stroke, and stroke is a sudden onset, usually it happens like that, and that person is fairly normal, they're at their baseline, and then all of a sudden there is a change. So if you see someone and you notice that they're unable to stand, they're less coordinated, they may be stumbling or not able to walk up straight, what we may see is that they're wobbling around, they're grabbing onto walls or objects, the couch or a rail, to help them, to keep them from tipping things over. And so we have to be mindful of that, because we can easily brush it off as, oh, they're just being clumsy today. Well, if we look at it in its totality, loss of balance could be that this individual is experiencing a stroke, and that may be the only sign that they're experiencing. The second one is dizziness. They're feeling faint, lightheaded, or like the room is spinning. And what we might see, what you may notice, is that they're unsteady with their movements, like motion sickness, or like they're drunk without having, any alcohol in their system. And so with vision changes, they may tell us that their vision is blurred, or they're having trouble with their eyesight in one or both eyes. And usually a stroke is unilateral. So it's usually one side of the body that's impacted. And one thing that's really unique about the brain is the right side of the brain generally controls the left side of the brain and vice versa. So when an individual is having a stroke, if the stroke is on the left side of the brain, we will see the effects of it on the right side of the body. So they'll have the weakness of the right arm. They'll have the weakness of the lower extremity on the right side. So we got to be careful and be mindful of that. When they're experiencing issues with their vision, what we may see is that individual rubbing their eyes. They may be squinting. They not be able to read, or they're taking their glasses off and on, trying to check and make sure, hey, did something happen with my glasses? So we have to be cognizant of the small, subtle things that an individual may be displaying that could be a potential sign of a stroke. Facial drooping. So one side of the face, as I mentioned earlier, may be drooping, or their face just does not look even. What we want to do is ask the person to smile, and we want to take a look at the face. Is their face even? Is their smile even? Are we noticing that one side of the face is drooping when they smile? The normal smile is happening on the right side, but the left side is not moving at all. Severe headache, pain, discomfort in the head, scalp, neck for unknown cause. So what we'll see them doing is kind of touching their head. They may be rubbing their temples. They may have some sensitivity to light. If it's someone who suffers from migraines, they might be experiencing migraine type symptoms with some other things added on, like the vision change, the dizziness, the loss of balance. The next thing that we might see in terms of the arms, there may be lack of strength in the arm or leg, especially on the one side of the body, as I mentioned. And they may want to go and lie down, or they might have difficulty doing simple things. I can easily open this water bottle. I was going to say, I think I can open it easily. But if you have somebody who's pretty handy and their baseline is that they have normal strength, or strength that's normal to them, and now all of a sudden they're having issues doing something that they do each and every day because there's weakness. The next one is numbness. There may feel numbness and tingling sensation in their face or their arms or their legs. Generally, what I've heard patients tell me is that it feels like someone's pricking them with 1,000 needles in their face or their arm. And so what they're wanting to do is, constantly touching the area, massaging the area, or shaking, the area to get it away, try and get that numbness sensation away. They're shaking their hands, or they're rubbing their arms, things of that nature. Another thing is they might be experiencing trouble speaking. So all of a sudden they're just not able to talk to you, or their speech is slurred, or it's garbled, and you can't understand what they're saying. I can, off the topic a little bit, I can recall when I had my first migraine, and for some individuals, their migraines present as if they're having a stroke. And so when individuals were experiencing what was happening to me when I was having my migraine, it appeared as if I was having a stroke because my speech was garbled. I could not say normal words, or I could not say words normal. And my speech was just, all discombobulated. So that's what you might be experiencing. So you can't understand their sentences. They're having difficulty carrying on a conversation, or if they're in the middle of a conversation, their speech begins to change. I can remember Martha Sagowski. She is a news anchor, and I can't remember the exact TV channel that she's on, but a couple years back, she was in the middle of a broadcast online on live TV, and her speech began to change, and she was having a stroke right on live. And we've seen it over and over on social media, on TV. individuals having strokes and you notice those subtle changes. Sometimes it's subtle, sometimes it could be very drastic. And so just, be mindful of the speech patterns of individuals that are around you. And the other one is confusion. They're unable to understand what's happening. They can't think clearly, or they feel thrown off. And so they may have this puzzled look on their face. They may look lost. They're shaking their head no, because they're having a hard time focusing, and they're having trouble making decisions. Call 911. We don't want to wait till all these symptoms start, right? But if they're having a myriad of these different symptoms, then we want to make sure that we're reacting and that we're getting this individual the help that they need. Who is most at risk for a stroke? We'll talk about that. Strokes can happen to anyone. There's a number of risk factors for stroke, some that we can manage, but sometimes there are things that are out of our control. So whatever we can do by diet, exercise, things of that nature, whatever we can do to improve our chances of having a healthier life, the lower our chances are of developing certain things. But then again, we have genetics, and there's just some things that you can't change with genetics. So in regards to age, strokes can occur at any age. And we've seen little kids have strokes because of different medical conditions. We've seen babies have strokes. Just the spectrum of individuals when it comes to age. Anyone can have a stroke at any age. 1 out of 5 people who have a stroke are under the age of 55. And your chance of a stroke increases as you get older, especially if you have some risk factors. And we're going to talk about those risk factors. Race: African Americans, Hispanics, Asian Pacific Islanders have a higher risk of stroke than our non-ethnic counterparts. Gender: women have strokes more than men, and more women die from strokes than from breast cancer each and every year. And there's something that I've really been focusing on and paying attention to here recently is the impact of hormones in women and the protective factors that estrogen plays in the lives and the health of women. And as women begin to age and those hormones begin to decrease, the estrogen, progesterone, all of those, we begin to lose our protective covering of estrogen. And so as women age and go through perimenopause, menopause, postmenopausal, the risk of them developing strokes, the risk of us developing strokes is higher each and every year. And if there's a family history of a stroke, then you are at a higher chance of developing a stroke. Your risk is increased because of that. So how do we manage risk factors? So some of the things that we can do, and some of the risk factors for developing a stroke is 1, high blood pressure. We know that. We've talked about that in the past. Atrial fibrillation is where the heart is just beating really, really fast and it's not contracting the way that it should. And it puts you at a higher rate of risk for developing a blood clot, which can then break off and go through your bloodstream, go into the brain and occlude one area of the brain or one of the pathways in the brain. That clot or that blockage then causes tissue death, which causes the stroke. Or it could be from plaque, from high cholesterol. The individual has a high level of cholesterol circulating in their body or up against the vessels, the walls of their blood vessels. And for some reason, a piece of that plaque breaks off, travels through the circulatory system, the veins, and somehow ends up in the brain and causes a blockage of one of the pathways or the blood vessels in the brain, which then leads to tissue death and a stroke. Smoking places an individual at higher risk for developing a stroke. Diabetes places us at higher risk. Poor circulation, a sedentary life or lack of physical activity, and then obesity. And I just want to say this: stroke reaction, don't regret, call 911. We want to notice the signs. You want to react. You want to call 911, and you 911, and you don't want to regret not doing something, because lack of prompt attention could cause this individual their life or cause them to have detrimental effects of the stroke. So one thing we got to do is educate ourselves about strokes, and that strokes can be life-changing. Knowing when someone is at risk for a stroke, what the stroke is, what types of stroke can help you. There's many different kinds of stroke, but a stroke in and of itself is a brain attack. It occurs when the blood vessels in the brain, as I mentioned earlier, called arteries, are blocked or they burst. There are many different reasons why a blood vessel can burst, and we won't go into all those details, but just know a blockage or a burst of blood vessel in the brain can lead to a stroke. And the consequences of the stroke can be long-term disability or even death. I have seen a broad spectrum of patients, individuals who have strokes and they walk out of hospital as if nothing has happened. And then on the other end of that spectrum, I've seen individuals who've had strokes and have died because of it. What happens during a stroke? And I just kind of gave you a little bit of that earlier, but there's an obstruction or damage to the arteries in the brain that prevents it from getting the necessary blood supply and oxygen. And this causes the brain cells to die. So that's when I said brain death. There's lack of oxygen, there's no blood flow to that area, and it begins to die. And it causes permanent damage. Our brains are smart. Some individuals who've had strokes, their brain was able to kind of overcompensate on one side of the brain and overcompensate it for the defect that happened as a result of the stroke. Depending on which part of the brain is damaged, an individual's ability to speak, to see, to move can become impaired. So it just depends on where the damage occurred. So there's two types of stroke. One is an ischemic stroke, and then there's a hemorrhagic stroke. So with the ischemic stroke, as I mentioned earlier, there is a blockage in the artery or the blood vessel, and it causes that area to die because of lack of blood flow and oxygen. This type of stroke accounts for about 80% of all strokes. So that's where you have that area that's clogged by plaque in the brain or in the arteries, or there's a blood clot, or there's a piece of plaque that has broken off and it's congregated in that one little area and it's clogged up the blood vessel, which leads to a certain part of the brain. The other type is a hemorrhagic stroke, which is hemorrhagic means bleeding or involving blood. This type of stroke occurs when the artery is ruptured, causing swelling, pressure, and damage in the brain. So if you think about a water hose, and there's a weakness in that water hose, eventually that area will burst, and the water, instead of it going around the water hose coming out on the end the way that it should be, you have water leaking out of the side wall of the water hose. So the same thing, I like to give some type of dim explanation of it so you guys can visually see what I'm talking about. But you begin to have this blood vessel that bursts, and now you have blood in the brain, which you should not. It should be contained within the blood vessel. And that increases the pressure in the cranium inside your skull. And that pressure increases and causes damage to the brain. So we have to be mindful of that. So how can we be smart about stroke? How can we be stroke smart? We want our family and friends to know that urgency is key. And I'm getting all of this information from the American Heart Association. They have some amazing tips and amazing education that's available for us. And so urgency is key. As soon as something seems off with a loved one, yourself, friend, and neighbor, we want to call 911. Get the facts. The strokes can be sudden. They can be easy to miss. And knowing the sudden symptoms are important. If you're around someone day in and day out, you know their routine. You know that I come in, I get up in the morning, I go and I do this. I make my, get my drink. I go up and I work out. I'm usually, at my computer prepared to work, or mom always walks the dog at this time, or mom always calls me at this time. And so we have to be mindful to pay attention to those subtle changes that could occur. EMS is there to help. So 911 is there to help. Calling 911, getting the emergency medical people there can help a loved one. Being wrong is okay, even if it turns out it's not a stroke. Call 911. I can tell you, I've had migraines, and I mentioned earlier that the migraines that I've had in the past, it looks like I'm having a stroke. It literally looks like I'm having a stroke. And I can remember going to the hospital and I'm telling them, when I'm able to speak, I'm not having a stroke. This is a migraine. This is what I need. Well, she didn't believe me. She wanted to life flight me to one of the bigger hospitals. And I was able to, talk her into letting my husband bring me over to the other hospital. They did all the tests. Everything came out normal. I was not having a stroke. I was having a migraine. And there are many other people who experience these same migraines, but I understand they had to err on the side of caution because every symptom that I was having was a sign of a stroke. Spread the word. We want to make sure that we're getting the information out to everyone, that there's people who need to know this information, that we're sharing it with our family and our friends, and that everybody is aware of what a stroke looks like and what we need to do. So in emergency, we want to act fast. Call emergency medical quick as you can. Waiting for help, we want to talk to the person, make sure that they're calm. We don't want to give them anything to eat or drink. This could impede medical care that they're going to receive. And if they're having difficulty swallowing because of the stroke, which many people do have difficulty swallowing, it may cause them to choke, and we don't want that to happen. So while strokes are not always preventable, there's several lifestyle changes that we can take to mitigate those risks or decrease the risk of our stroke. And one, as I mentioned, maintain a healthy diet. So a diet low in saturated fats, low in cholesterol, low in sodium, making sure that we're staying active. And, I mentioned this previously. We want to make sure that we're getting at least 150 minutes of moderate exercise each week. So that's 5 days a week of 30 minutes of moderate exercise. Making sure that we are monitoring our cholesterol and our blood pressure and our blood sugar. So knowing your levels and knowing what you can do to change those numbers in the positive. I can't tell you, there are so many people that I know who deal with high blood pressure, and for whatever reason, they choose not to do anything, or they don't believe the machine, or they don't believe the doctor, or they feel like the medicine is going to poison them, or whatever their or is, right? They have a reason and a rationale behind why they're not actively taking the steps to control their blood pressure. And my concern is that eventually they could have a stroke. Another one is avoiding smoking and excessive alcohol consumption, and then making sure that you're following up with your healthcare provider for those annual checkups. And if you're feeling off, if you have a headache, if you have any of those symptoms, be fast, right? We want to make sure that we are getting to our healthcare provider quickly, or getting to emergency room, or calling 911 to make sure that these individuals are getting the screening and the care that they need. One stroke could change someone's life forever. And strokes is, no one's exempt from it based on your age, based on how healthy you are. It could still happen. You can still have a stroke. And so we have to do our due diligence to make sure that we're doing what we can to make sure that we are decreasing our risk for a stroke, and that we know what to do in the event of a stroke. So if you are not sure, if in doubt, still call 911. If in doubt, still seek medical attention. If in doubt, err on the side of caution. We want to make sure that we're saving lives and that we are acting fast if we are witnessing someone have any of the signs and symptoms of a stroke. I'd rather send someone to the emergency room or to the hospital to get them checked out, to get them evaluated for a stroke, and it turns out that it's not, than to make the decision to delay treatment. And this individual ends up with catastrophic injuries because of the stroke or dying because of it. 1 second could save someone's life. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Stay safe and be well. Until next time, we'll see you later. Bye.